Exodus of health workers is taking a huge toll in Nigeria. As such, the House of Representatives Committee on Health has raised concerns over the decline in the country's health manpower. The committee disclosed that due to relocation of doctors and nurses from the Lagos University Teaching Hospital to various parts of the world, 5 wards comprising of 150 beds have been shut down, while 400 consultant anesthetics left Nigeria in 2 years. The chairman of the committee, Amos Magaji, described the situation as worrisome, saying the legislative arm is working towards nipping medical brain drain in the bud by building state-of-the-art infrastructure and making the sector attractive and rewarding to workers. Julie, this is very sad.
It is. It is. When you look at anesthetists, for example, across the world, there is an acute shortage of them.
Those who specialize in
they put you to sleep. Yeah, put you to sleep so that the procedure can be done. And all that. When you just wake up, you just see that they've been operated upon. So all over the world, they are looking for them. Nigeria used to have 1,200 of them, but we are now down to 800. And the funny, the worrying thing is that this is a trend that is continuing. It's not as if, oh, next year many more won't leave. I would not be surprised if even these 200 are left in 2 years. I mean, even these 400 are left in 2 years. 400 could actually live in 1 year.
Or be on their way.
As we are talking, some of them they have one leg outside.
Exams,
they want to leave.
It
is the health sector will collapse if we do not do something urgently. The government must do something urgently. Across the world, our doctors are being sought after. In Egypt, that many Nigerians even go to for Medicare, a lot of their own doctors are leaving for Saudi Arabia, leaving for UAE, leaving for Qatar, leaving for UK, and all that. Nigerian doctors are the third most sought after in the UK and America.
Why?
Because they are looking for such skilled manpower.
They are well trained.
And when our people even get there, you know, the adaptation is easy for them. We can say all kinds of negative things about our country, but they train them well here. And that is why when they get to that place, they write an examination there.
Yeah, conversion.
But they don't have problem with passing.
They pass.
Because of the rigorous training that they got here. And don't forget, even when the brain drain became an issue in the 80s, Saudi Arabia was grabbing our doctors from here, bringing them to Saudi Arabia to come and work. UCH used to be the hospital where the kings of Saudi Arabia used to come and have a Medicare in the 70s. It used to be one of the best hospitals in the whole of the Commonwealth. In fact, one senior medical doctor was telling me that in those days, when they talk about medical research, they talk, in the whole of Africa, they talk about Legon. They talk about this university in Uganda, Makerere or so, and then UCH. Those were the 3. And they are so well respected across the whole of the Commonwealth. That is why doctors trained from such citadel of learning, you cannot wish away the quality of training that they've received. The whole world is waiting. Wherever the Nigerian, because the indomitable spirit of the Nigerian will always prevail. When they get there, whatever fresh training you give them, you will see that they are going to pass and they will adapt easily. You don't pay them well here. Until we decide to pay these people well, care about their welfare, until we provide the equipment, because they want to also work with some of the best trending new equipment in the world. Because that's how they too can become total medical doctors, if they have the right tools to work with. Is it not in this same country that they were using phones to do surgical procedures? No light, no light. You had to switch on. Did your friend Joy Bokwe not tell you how he lost his brother? Here in Lagos, you are using phone to do surgical
full torchlights.
You know? So when Egypt had that problem, they came up with the idea of saying, okay, before you can japa, you must work for 3 years in a public health institution. I think someone tried to introduce that bill.
Abuse that
the Senate the other day. The bill was defeated. Was it Senate or House of Reps? I can't remember. Was it earlier this year or last year? The bill was defeated because Nigerians said no. That will amount to stopping economic migration. Our own is approaching the level that everybody should be worried. It's not, even dentists are leaving. What do they call these people? Laboratory technicians are leaving.
Nurses
are leaving in droves. So it's like this anesthetists. I didn't even know that it was this bad until they raised this alarm. Even pharmacists are leaving.
Even admin staff in the hospitals. So bad. And the problem they're having now is like lawsuit, for example, the state government makes it, easier for lawsuit. The moment they go, replace. The moment they go, but it gets to a level, experienced people will go, you bring, so for them to catch up, they go again. So the system we are stuck.
We can't
even the people, the managers of the system are so
frustrated now.
That so every time they have to train and retrain, and the moment they get the training, they're out. Another people, you have to get another one. So it slows down the work. And now, the way we are going, do you know that most of the nursing programs in all the teaching hospitals, all the universities, they are oversubscribed. Why? Not because people want to practice medicine. They want to go out of Nigeria, and they know that within a year or two, they pass out of that program. With that certificate, they are needed everywhere. It has become so bad. In our universities now, do you know the trend?
No.
Virtually all the young ones are out. At the point, government, I think, during they came up with they make first class. They make first class.
1 week. 1 week. 7 lecturers left in 1 week. She was telling me.
So young ones.
So me, is this bad? He said, it's even senior people. Senior people. Said one woman walked up to her and said, Madam, law, and that she was like, you too? And it's a very frustrating experience for
you can imagine that a professor in any Nigerian university, public university, doesn't hand $500 a month.
How will he hand $500? No, he said, what is their salary? It's around 500,000 and all that.
That's a professor.
They don't hand that.
I use your whole life.
Oh my God, it's so bad. And the workload now in our universities, in our teaching hospitals, because many people they have to work.
If we discuss that, maybe if next week we'll discuss that of the universities, because this Jackpot thing is a threat not just to health personnel in Nigeria, to all sectors. It's even a threat to the economy, because I don't see how you can stabilize the economy when people are living from critical segments. Banking, people are leaving. I told you before about one that in Canada, Zenith Bank.
Yes.
The former staff formed a WhatsApp group. Those of them who are in Canada, they formed a WhatsApp group of their own. That's to tell you how many of them have left. is so bad that
even the IT guys left in droves.
In the banks.
Yes.
Virtually all the banks are having problems because all those IT
And
guys.
it's affecting service.
Yes,
it's affecting service.
Badly.
Because the best that they have left. What do you do? Was it not a man who said that in Ikorodu here, Ikorodu, a private hospital, lost 12 health practitioners in 1 month? A private hospital, not to talk of what is happening. My younger brother, who is a doctor, told me that in the past, this migration used to be limited to senior people, like consultants and but now,
specialists.
Now, people, as soon as they are coming out of medical college, they're already thinking of going out. It's no longer limited to people who have families, who have been practicing for. As soon as they are coming out of medical college, they're already thinking of leaving. One sent me a message. We were here discussing one day. He now sent me a message. He said, Babajide, we met in Makurdi the last time you came around. I regret to tell you that as I'm writing this, I've already perfected my plan to travel. By next week, I'll be leaving with my wife-to-be. It's gone. He was even apologizing. I'm like, what are you apologizing for?
I don't know.
You know?
As in...
So the thing, if they can...
How can we...
If they can shut down,
if
they can shut down a ward with 150 beds. You can imagine what it means if that trend continues. Lut is the biggest hospital in our country. But Lut represents what is happening across our health institutions. So if 150 can live like that, leading to the shutdown of a ward, it means that even healthcare delivery, whether we like it or not, is being impacted by this Japa syndrome. We can no longer behave like, look, it's a normal thing for people, economic migration is not limited to us and all that. No, we've got to do our best to keep this category of workers. And one of the ways by which we can do it is to build the state-of-the-art infrastructure, make the sector attractive and rewarding to the workers, you know, pay them well. Pay them well.
No.
If we do not pay them well, they will not want to stay here. No. And overall, government must improve the economic situation of our country. Make our country generally pleasing to live in. If Nigeria is a beautiful place, they say we are among the happiest people in the world. I do not doubt it. Our people, a lot of our people...
They're not asking for too much.
Of course not.
Just stability in the economy.
The standards of our people are not high. If you build roads for them, they will be praising you to high heaven. Whereas in other climes, those things are even taken for granted.
If you pay them salary, they'll be saying you are going a lot.
So if you pay them well, they will stay. But if we don't pay them well, we treat them that they are not important, we are forcing them, we are pushing them to go on strike all the time, the next minute they will be thinking of leaving the country. And we will be the National Assembly simply speaking grammar. Doctors should earn far more than National Assembly members, for example.
Some state government
people are saving lives.
Some state governors hold their health workers.
Yes. Abia was owing workers. Now they even went on strike because of it. You are owing doctors. Come on. Somebody who is in the business of preserving life, you are owing him. You are endangering the life of patients.
Not motivated at all.